phone. I'm not able to connect.
Okay. Shall we go ahead and start and then wait for her?
Yeah. We can start.
Okay. All right. Okay. Yeah, I mean, one of you could just let me know, sir. You or Vinay sir could just let me know if they join in between. Yeah.
Yeah.
I can't see anybody else. Yeah. All right. Good evening, everybody. A warm welcome to all of you today, all of you joining us. So, on behalf of the Indian Teachers of Psychiatry, Psychiatry for You, the Minds United for Health Sciences Humanity Trust, the IPS PG and UG Education Subcommittee, it's my pleasure to welcome you all to this panel discussion. So, our panel discussion is titled Psychotherapy Research in India: What Editors Are Looking For in Publication. What sort of makes today's session a little special is that we are getting to hear from some really esteemed editors directly about what really strengthens a psychotherapy manuscript, what weakens it, what directions the field needs to take next. And while the psychotherapy Indian research output is growing, it is still emerging. And our hope is that today, with this diverse panel, we'll be able to demystify some of this publication process that is there, perhaps even reduce the hesitation around academic writing with respect to psychotherapy, and also encourage early career psychiatrists and residents to actually take the psychotherapy work to the publication stage. So that's what you're hoping for. And before we actually move to the panel, I thought I could invite a few words from the IPS leadership who have joined us today. I'll go directly to Dr. TSS Rao, the Vice President of the IPS. So if you could just share a few words.
Good evening, and I'm extremely happy that very innovative programs are being designed, and we are trying to reach people and encouraging them to areas where not so explored and which actually has a lot of weightage. I have two jobs to do. One is, of course, greetings from Indian Psychiatric Society, and let me assure you at this level itself that next year, whatever help and whatever best encouragement necessary for this, it is there straight away. That is one aspect of it. Second one, I have a background of publishing quite a few journals and being associated with quite a few journals, even at this juncture. There are a lot of interesting things to explore. Why I'm telling this is, we are quite successful in quite a few areas, and I have thought little differently from many of the editors. So that is the second point. Third one, of course, one of the most neglected aspect in psychiatric training, again and again, it is being emphasized that it is psychotherapy. Not for any other reason except that it is little nebulous or very concrete data and evidences not being available. And the third one, whatever you want to plan and however you want to plan, there is likely to be some deficit or deficiency likely to persist as far as this area is concerned. Now there are plenty of postgraduate training centers have come, and each one may not be equipped adequately. But what I am seeing, the very bright light is many programs happening online. That way, nook and corner, the postgraduates have this wonderful opportunity now to look into, learn, and practice in their clinical setting. So these are a few good things that are actually there. And I wish this program all the best. And we are looking forward to a lot of other major innovative and big production from this section. And I must congratulate Kishor and many other people who are involved in this, because UG, PG, faculty, these were the three separated sections earlier. In between, a lot of mixture happened, but all said and done, the purpose and aim with which actually these were designed are being sustained and improved. All the best, and it is something really very heartening. Thank you so much.
Thank you, sir. Thank you. And we'll hold you to that promise of next year as well. I think from the IPS leadership, if I could just next invite Dr. Aleem Siddiqui to speak a few words and share his thoughts as well. Sir?
Thank you, sir. Thank you so much to the team for inviting me. My respect and regard to all of you, office bearers here, the editors, I'll be very brief. I think I am an editor of a very small journal. So, as an editor, what I'd like to look in psychotherapy is summary of old. So, if you are able to summarize old points so that they are ready to use, and then any research of emergence of new techniques, new modes of you can say communication, and this integration of AI into therapy. So if we are able to, because I would like IPS to take lead on this, many people are working on it. If we don't do this, the technology people, the IITians will take away this field from us. They will become the more masters, we'll become their employees. So that is a few things from me. Thank you so much. Back to you, sir.
Thank you, sir. Thank you. Sujit, sir, as the honorary editor of the IPS Official Journal, could you speak a few words, sir?
I think this initiative is really nice and commendable. My regards to all my co-office bearers and the team. I think I would rather speak as a part of the panel and not waste time here. Thank you very much once again for this initiative.
Thank you, sir. Appreciate it. Dr. Kishor from the IPS PG committee. So you are on mute.
Yeah. Sorry. Good evening, everyone. With the best regards from IPS PG Education Subcommittee, it's a privilege to be part of this program. The president of IPS, Dr. Savita Malhotra, she said she had to travel urgently and she could not make, but she said this is very important. And the IPS and the IToP are keenly looking to strengthen psychotherapy training in India. And we have Professor Mohan Isaac, Professor Matthew Varghese, Professor Raghuram, and others who have actively taken up the program. And the National Conference on Psychiatry at AIIMS Bhopal emphasized minute details about psychotherapy and the consensus of IPS and IToP. Now, very importantly, I echo what Rao sir said, that in India, we have more than 350 institutions which are offering psychiatry postgraduate training in DPM, DNB, and MD. Beyond that, also, we are giving postdoctoral fellowship DMs. At any given point of time, we estimate 1,200 to 300 students might be involved in postgraduate psychiatry training. At any given point of time, 4,000 to 5,000 postgraduates are getting training in psychiatry. This is huge number, and there is a urgent need. How do we engage these number of psychiatry postgraduates to learn the skills of psychotherapy? And we require a lot of faculty to come up with innovative ideas, mindset to deliver psychiatry training, which incorporates psychotherapy. And I really appreciate our treasurer, Dr. Aleem Siddiqui, who said, if you do not train the faculty, and if the faculty do not train the postgraduates, and if the postgraduates do not have the skills, obviously this will be taken up by AI in a different manner. So it becomes very important. And we are really thankful that all the editors turned up for this important, because this program will be recorded and it will be available so that people can reflect upon what kind of research is required. I'm really thankful to all the editors who thought about this program. I believe the IPS UG committee, if Dr. Avinash, Priyaranjan Avinash is there, or his co-chairperson, Dr. Kiran, might be there in this program, we have committed ourselves that we will do everything possible for undergraduate and postgraduate psychiatry training. With this, I hand over to Suhas. Thank you so much, Suhas.
Thank you, sir. Thank you. Is Dr. Avinash from the IPS UG committee, sir? Are you here? In case he's not here, sir, Dr. Kiran, can you just speak on behalf of the IPS UG committee?
Yes, thank you, Dr. Suhas. Thank you all for giving this wonderful opportunity. I am representing the UG subcommittee of IPS. And as Dr. Kishor was mentioning, at the Bhopal conference, we all acknowledge that there is a huge unmet need with respect to psychotherapy. And what we thought and what we gave a position statement there in that conference is UGs are the right person to start the psychotherapy program, because almost 120,000 students are coming out from our institutes every year, and that's a huge number. NMC has thought about it and has come up with the ADCOM module. So we would like to add value to that module and see how psychotherapy at a very basic level can be incorporated at UG level. And we have promised few things with the help of Dr. TSS Rao will be taking over next. We would like to fulfill this promise in the coming year. Thank you for this opportunity.
Thank you, sir. Thank you. Thanks to all of you for all your encouragement and support from the IPS leadership. I think we'll just straight away go into the panel. And I'll start by very briefly introducing the panelists. And I'll start with the first person on my screen, Dr. TSS Rao. Sir is the editor of the Journal of Psychosexual Health, but he is much more than that. He one of the longest serving editors of the Indian Journal of Psychiatry, and for all of us as early career psychiatrists initially, he was the one who put psychiatric scholarship on the global map. So very glad to have you with us, sir, and looking forward to hearing your perspectives as well. Next on my screen is Dr. Sujit Sarkhel. Sir is the current honorary editor of the Indian Journal of Psychiatry, a journal that gets published every month, and he and his team does a massive job in terms of keeping the continuity going and the wide spectrum of articles that is published. Yeah, sir, hearty welcome to the panel. Next on my screen is Dr. Rajshekhar Bipeta, sir. Sir is the editor of the Indian Journal of Psychological Medicine, which is the official publication of the Indian Psychiatric Society South Zonal branch, and the methodological rigor there and the clinical relevance of the journal and the number of articles that gets published ahead of print is a massive job again. And sir has done a tremendous job in taking that journal to such high levels as well. Yeah. So a big welcome to you to the panel. Next on my screen is Dr. Vijaykumar Harbishettar. Sir is the editor of the Journal of Psychiatric Spectrum, which is the official publication of the IPS Karnataka. And it's a very young journal, but for all the audience here, in very quick time, the journal has grown in leaps and bounds. And in terms of indexing, in terms of its audience, it's really grown so very, very fast. Sir. A big welcome to you to the panel, sir. Thank you for joining us. The next on this thing is Dr. Priyash Jain, and Priyash is the editor of the Minds newsletter. So rather than a journal, Minds newsletter was it's now well crossed a decade since the newsletter started getting published. And the Minds newsletter is published with the intent of getting UGs and residents to write articles and write communication pieces there. And I think Priyash has really sort of put it all together and taken it to the next level with the audience and the readership of the newsletter increasing as well. And Priyash will also bring in a unique perspective about getting young students to write for the newsletter as well. Yeah. So Priyash, hearty welcome to the panel. Right. Okay. So what we'll do is just a few house rules to all of us here. It would be very nice if all of you, except the panelists, if all the panelists could just put on their videos, and if all the other participants can actually ensure that they are on mute. And please feel free to put in questions into the chat box as well. And what we'll do and the flow we'll have is we'll go through 3 rounds of questions, with each of the panelists being asked the same question in each of the rounds. And I would encourage each of the panelists to answer very concisely and precisely, maybe a minute and a half or 2 minutes for each of your responses so that everyone gets equal time. And once we finish the 3 rounds, we will open it briefly to an audience Q&A and get other perspectives here. And there are faculty here, there are senior faculty here, there are young students here, residents here, and it would be great to have some time for Q&A as well. Yeah. So with that, I'm just going to dive right into round 1. And for the audience, we had shared some of the questions with the panelists in advance as well, around 24 to 36 hours in advance as well. So the first round that we thought we'll actually cover is in terms of where we are today in terms of psychotherapy research and submissions of these research in India. And the first question that we sort of wanted to ask is, How often do you, as editors, receive psychotherapy-related submissions from India? And also in terms of what kind of papers do you commonly receive? What are the strengths of these papers that you see? Yeah. So I'll just start with Rao sir, perhaps. Sir, can we start with you?
Okay. Of course, the point is the context is extremely important. When I was the editor for Indian Journal of Psychiatry, we used to have almost around 140, 150 submissions, and it was quarterly publication, and we had around 8 to 10 original articles to publish, and maybe one or two reviews, and a few of the other sections. But of course, the important point is we had every section covered, and one of the reasons why it stood number one in the Ovid group of journals for almost 6 years as number one among the top 10. Okay. That time, even though basically I like some of these psychotherapy related articles, we had no way to publish it, not because of anything, but there was no availability of space. They used to get rejected, and if I can remember very clearly, around 90 to 95% was the rate. Somewhere we were hovering around much of the time. But let me tell you, I was part of Indian Journal of Psychological Medicine some time, and currently, of course, Vijaykumar keeps me involved with the Journal of Psychiatric Spectrum. Let me talk about Journal of Psychosexual Health. Though this is a quarterly journal, and what we are seeing, almost around 10 to 20% of the articles are based on narrative and experiential reviews. And I was a little anxious in the beginning whether these things will get citations, because that is one of the important area we were trying to look for. But let me tell you, because none of the other journals publish this, and if somebody has to do some work on that and has to quote and cite, this is the journal which is getting such a big, wide audience and a whole lot of things. Let me tell you, say for example, very recently, maybe about 6 months ago, what we published, this particular lady's sexual issues related to the cancer patients, and the data related to that was published. And then she sent me one more article telling that how she went through it and what are the difficulties that were actually involved. We published it. And what I could see is a number of responses, and actually people who have looked into it is something phenomenal. I was never experiencing, but expecting that this will happen. But this is my experience as a journal, first hand and from the horse's mouth. What I am trying to tell you, in fact, when I handed over the Journal of Indian Journal of Psychiatry, we used to publish. Say, for example, when we were there and as an editor, as I told you, number one in the Ovid group, Wolters Kluwer, this particular journal had become a case study. What it means is, from a Islamic country, and this particular journal is standing number one, and that we a focused journal in psychiatry, what is actually happening? So one of the conclusion among the many things was that this is catering to all the categories of people. So one of the advice from my side is actually that let us not jump to the conclusion that only the data matters. And when we are trying to look at citations, reviews and narratives and other related articles also carry as much weightage and importance. And data related things, of course, they get quoted, but not as much as these articles get quoted. So there is a wide scope is there. I have this weakness of continuing to talk for a long time. So let me stop at this level, and I'll get back to depending upon what type of comments and other ideas that come up. My conclusion at this particular level is psychotherapy is an important area. Minimum number of people are doing, and there are certain areas where there is no other alternative apart from behavioral or psychotherapeutic techniques. Data alone not going to matter all the time, and this has a very wide potential for citations and actually quotations in editorial publications.
So one very quick follow-up. In the last 1 year, how many psychotherapy related submissions would you have got for your journal, sir?
in our, say for example, see, sexual medicine is a little different type of area altogether. That is one, that's what actually I was telling. The context really matters. And when we are trying to look at, let me tell you, almost around 20% of the articles in Journal of Psychosexuals is related to one or other form of psychotherapy.
Okay. Thank you, sir. I'll come back to you, sir. Sujit, sir, how often do you receive psychotherapy submissions, and what kind of psychotherapy submissions do you receive?
See, Suhas, actually, not too many. First of all, if you look at the percentages, maybe less than 5% in terms of submissions related to psychotherapy. Now, here could be other reasons also. First of all, maybe uh, more of people who are in psychology, they actually go for publication related to psychotherapy, and it often finds its way in journals related to psychology. This could be one possibility. Secondly, I do get whatever we get, many of them are often simple psychoeducation modules. Problems with some of them are they are not adequately powered, or some of them do not know that the study has to be pre-registered in clinical trial registry. That is another problem. So overall, not too many properly powered and good quality studies. Number one. Number two, as Rao sir was saying, it matters of psychotherapy, since this whole discussion and also the effort of IToPs and the UGPG Education Committee of late has been to sensitize the residents to the importance of psychotherapy. I would even be open to not only narrative reviews. I would even be open to, educational articles which summarize. See, you must be knowing we have this scholars corner, so wherein we talk about different aspects of research and similar things. Maybe we can have something on qualitative studies someday. Similarly, we can also have very lucid articles which could be a good takeaway article for residents related to certain nuances of psychotherapy, which may not always be easily available in textbooks or standard journals. I'm open to similar submissions also. However, we are not getting too many. So probably maybe over a period of time, I might have to solicit certain submissions. Unfortunately, in this era of secondary data, there is no limitations as to which kind of person can submit which kind of secondary analysis. And I end up getting a lot of SRMAs from, say, sometimes the Chinese meta-analysis factory, wherein a group of engineers would have done meta-analysis on the role of depression in tuberculosis or things like that, so some things, sometimes these kinds of things we end up with. Other than that, if you talk about quality submissions, less percentage, less than 5%.
Thank you, sir. Less than 5%. Yeah. And a very interesting take on the SRMAs as well. And I'll come back to that in the next round as well, sir. Thank you for that. Rajshekhar, sir, similar question with the IJPM, sir.
Yeah. Thank you very much. See, one thing I really like what Aleem sir said, which Sujit also has talked about, the AI thing, especially engineers and other people who have greater access to AI, they are actually doing a lot of submissions. So that's a very, very important issue, and we have to be very careful. We have a dedicated practical psychotherapy session in our journal. So for that particular section, we get a lot of articles, and I would say for past 1 year, around 70 to 80, it could be even 100. That is one part. Second is the most common themes are CBT, trauma-informed therapy, related to LGBT issues, digital and AI-related supported psychotherapies, mindfulness we get quite a lot, and then spiritual and religious. So let me be very frank. Most of such articles we are actually doing desk rejections because we have seen that many of these articles are actually of not good quality. So I don't want to name the institutes, but from mostly the publications from those institutes who have very good clinical psychology departments, mostly the submissions from those institutes are really good quality. Without any bias, I'm telling that. and most of these actually go for desk rejection. Limitations, quite a few. No CTRI registration. There's a very big problem. Many people think that CTRI registration is only for clinical trials. So it is for anything which is related to pharmacotherapy, psychotherapy, psychoeducation, academic, policy-related issues. If you do one intervention now, after 10 minutes, if you are doing reassessment, it is an intervention. And many of the psychotherapy-related submissions do not have CTRI registration. Like what Sujit said, many unqualified professionals are there on the panel. So they directly go for desk rejection. Very, very generic articles. Very important lacunae, what I found is they just say that we have done CBT without giving explicit details, actually what they did. See, the practical psychotherapy section actually wants very, very clear. We have a proper what they did in those sessions. So those explicit details are not provided. And unfortunately, I don't know whether there are any original articles, RCTs, or meta-analysis from India on psychotherapy-related studies. So that is what I'm going to look into. Thank you so much.
Thank you, sir, for two very good points on the methodological rigor and, of course, the caution with the CTRA as well, sir. Yeah. Thank you so much. Vijaykumar, sir, what about the Journal of Psychiatry Spectrum?
Thank you, everyone. Thanks, Suhas. Thanks. I must thank the organizers first of all, because this is a very important topic that's been discussed today. This was actually discussed a few months back in advance when Dr. B.M. Suresh took over as psychotherapy chairman for the Department of Psychiatry, and we had a meeting and we all discussed this issue. Many of us were, many faculty members, SRs were part of this discussion. And there this issue was discussed that there's a need for improving the psychotherapy training as well as the research output in India. And this was also discussed, I think, in the, teachers conference in St. John's, I believe. And I think that is very important. And I've been looking for such papers. Unfortunately, I have to give a number. If I have to give a number, 1 to 2%. And the fact that I was part of organizing the SRMA, there was I think three. Only I got one accepted, one rejected, one I think they could not submit for some reason. So 3 SRMAs were actually on psychotherapy part. One is CBT and the others are one is acceptance and behavior therapy, acceptance and commitment therapy rather, and that got published. The CBT didn't get published; it was rejected. So it was very important, and I asked Dr. Suresh about, because he was a chairman, to take up this scholars corner that Dr. Sujit was mentioning, and when he wrote, it looked like more of directive. Then I had to take it as an editorial. So then I had to ask him, I need 1 or 2 pages every time. I want, basics of psychotherapy to be written in the journal, and we need to publish psychotherapy work. Coming back to the basic issue, that's been covered. Dr. Sujit already mentioned, not adequately powered, no CTR registration, and all this. I think I'm looking for qualitative methods in psychotherapy that's more feasible and doable, is what I would point out at. Back to Dr. Swasan.
Thank you, sir. So I'll come back to your excellent point on SRMAs actually, and I know you've done a lot of good work there. In the next one, I'll just come back with a follow-up question on SRMAs as well in psychotherapy, sir. Thank you, sir.
Yeah. Sorry for recently.
Sure,
I'm sorry for that. Recently, we had one ACT. It is accepted for publication. Yeah.
Oh,
sorry.
Okay. Yeah. Thank you, sir. Priyash, hi. So, you are the editor of the Minds newsletter, and you get a lot of reflective pieces also, I assume, on psychotherapy and students. Can you just sort of tell the audience the kind of psychotherapy-related submissions you get and how you evaluate them?
Yes, sir. Thank you, sir. Sir, from the perspective of Minds newsletter, which is a UG and PG based newsletter, more of a newsletter than a proper journal. We received quite a handful of submissions over the past 1 year. And most of them were usually pieces like dealing with the communication skills or empathy, or maybe doctor-patient relationship. Recently, we published something, just a piece on something AI-assisted psychotherapy, AI-assisted CBT. So these were the submissions that we're receiving, but still, there were only handful of submissions over the past 1 year. I've also went through the archives of the newsletter because I've been the editor for just past 1 year only. And I looked through the archives, what we received or what we published over the past 10 years or so. And what I observed was that there have been some increase in the submission related to psychotherapy over the past couple of years. In the earlier years, there were not that many of the psychotherapy related articles, but over the past couple of years, there is some increase, not that much. Again, as was earlier pointed out by Kiran sir, that in a country where we have around 120,000 medical students, UG students passing out every year from 800 medical colleges, the number is still quite very low. So there's still need for us to bring up more kind of articles. Basic articles will do for Minds newsletter, like communication skills, or maybe something to them related to empathy, or maybe psychoeducation. But we need to have more articles in the newsletter. Thank you, sir.
Right. Thanks, Priyesh. So thanks for clearly stating also you're looking for some of these articles as well in terms of reflective pieces and case learnings and educational articles. You're looking at that. Yeah, very clear statement there. Yeah, thanks, Priyesh. So thanks all of you for giving us a very realistic and a very honest picture of where we stand today in terms of psychotherapy research. I mean, numbers like 5%, 2%, the high rates of rejection, in high contrast to the Journal of Psychosexual, which is 20%. So you can see context really matters, and the subspecialty and specialty also matters. Yeah. The next round, we are just going to look at what editors actually expect from the Indian faculty and Indian students as well. So the question essentially to all of you is, what type of psychotherapy research do you feel is most needed right now in India? You could answer in terms of methodology, like some of you were saying, in terms of qualitative studies are required. Or you could also answer in terms of population, let's say child and adolescent, or in terms of a rural population. Or you can talk about cultural adaptations, or any format that you feel. So what type of psychotherapy research is really needed right now in India is the question that I'm asking. I'll start with Rao sir again.
As I mentioned earlier, when I was editor for IJP, we hardly had any time to look into any type of psychotherapy studies. It used to be just not possible, not because of anything, but there was no scope for that, for publication. But when I look at say for example, psychosexual medicine, we are still hardly the worthwhile data, but more than anything else, quite a bit of work is happening from many of the specialists who are in this field. Say you talk about sexologists, psychologists, and many other people. The number of cases what they have seen, and qualitatively what assessments they have done, and certain experiential and other related things what I was trying to talk about, either maybe narrative or experiential. These are the type of things what we are getting. See, my advantage and this thing is, say, for example, overall, if I try to look at the articles that are there, when we are trying to look at hardcore data, they are related to either STIs, HIV, or some of these type of things. But when we try to look at, say, for example, I'll tell you one of the article which I published when I was editor for Indian Journal of Psychiatry. That means the Hodge syndrome. In what particular way, say that CBT or other therapies can be done in this particular case. This was from Nimans, but I was extremely happy. But those type of things are possible in my journal, and that's one what actually I'm finding it useful. That is one point. Second one, of course, we are also inching towards the rejection rate of around 40-50% now. Also talks about many of these things are related to some of this type of behavioral techniques where many of the things are not well controlled, and not adequately meeting power and a whole lot of other deficiencies that may be there. But what important lesson? Basically, I am not as strict an editor like some of the people who are there in the panel here. Say, I can look at Rajshekhar, Bipeta and Vijaykumar. They're really very what call critical editors. Even to a great extent, maybe Sujit also I can bring into this. What I am seeing is actually how appealing it is and how some of these type of modalities can be utilized in the treatment. So from that particular angle, that word again, I'll bring the context really matters. So maybe the number of submissions in the qualitative studies is maybe about half maybe there in our Journal of Psychosexual Medicine, of which those who meet a reasonable rigorous component and maybe methodologically well done, that way around 15-20% is the range actually what we are getting. So again, of course, this context is one of the extremely important things.
Thank you, sir, for the context-based answer and for looking at treatment-based intervention models. So next we'll go to Sujit, sir. So what are your thoughts?
Suhas, can you just come back to me after the next speaker? I'm just on the call. Just a minute.
Sure, sir. Rajshekhar, sir. So what types of psychotherapy research do you feel is needed right now?
Yeah. So before going to the question, I would just want to highlight that one of the psychotherapy-related qualitative study guideline, which was published in our journal by Berg et al., it is now actually in the Equator. So this is something very, it's an important achievement for our journal. So we are actually now, it's not about promoting our journal, but basically like we know that there are reporting guidelines for most of the articles, like original articles, whatever it is. But for psychotherapy-related research, qualitative studies, there is no proper. So this is one thing I wanted to tell. Now, coming to your question, we are actually getting a lot of submission. What we need basically is culturally adapted models, because it's very important. Psychotherapies are very much related to local issues. And when I was doing my PG, there was a very famous or ill-famous concept saying that Indians are actually not tuned to undergo psychotherapy. And time again, it has been found that that is not true. Many times people from rural places also come and tell that they want psychotherapists. They actually, few patients we get who say they want CBT. So, but however, it is very important that therapies should be locally tailored. There is a very, very important need for therapies in the field of couples therapy, CBT, interpersonal therapy, DBT, trauma-focused therapies, and also family therapies. Because this SARS Bahu thing or something, whatever it is very unique to our country. So something like that. Severe mental illnesses, throughout our PG curriculum, we have learned that CBT is found very useful in psychosis. But unfortunately, I don't know whether there are very good quality studies from India on CBT in schizophrenia or those with dual diagnosis. There's a very, very huge need for child and adolescent population for autism, ADHD, learning disorders. Definitely trauma is an in thing now. Those in relation to natural disasters, domestic violence, child sexual abuse, suicide prevention and crisis psychotherapy. Definitely, there's a very huge need for digital and AI supported therapies, but extremely important, the team member should be a qualified mental health professional. So that is the disclaimer. Without that, somebody else doing is not accepted. And psychotherapy for marginalized and vulnerable populations like tribal communities, LGBTQ, prison population, persons with disability, prison population, we know is a very, very vulnerable group. Caregivers of dementia, end-of-life psychotherapy, we know that we talk about psychoeducation for caregivers, but no real models for India, end-of-life psychotherapy and all that. Thank you.
Thank you, sir, for that big list and a very detailed list of those underrepresented areas. I just had a follow-up question on this. So do you feel, and I know you feel strongly about this, now I'm not talking just about IJPM, just generally in the publishing landscape, do you feel there is a publication bias towards Western models? I mean, you see a lot of dominance of CBT, DBT, psychodynamic frameworks that are developed in the global north. And do you feel that, in one sense, our ways of doing therapy, are we publishing that enough? Because there might be a compulsive need to mirror Western models as well. What are your thoughts about this publication bias, sir?
See, one thing, Suhas, I'm very much against this concept of uh, Indianizing everything. I'm a very, very staunch Indian, but then saying that India-like studies. See, when we talk about a journal which is there online, visible to the community worldwide, we cannot have a India-like study unless and until culture actually has a huge play. So psychotherapy is a very important such place where culture has a role. And definitely there's a need for culture-based local issues. But having said that, we cannot have a culturally based model for Karnataka and then another study from Telangana. So when we talk about culture, it should be for the whole India as such. So region specific, let us not talk about, but for Indian subcontinent, a proper module, I think that is very, very important. Thank you.
Thank you, sir. Thank you for that honest answer. Sujit sir, can I come back to you now? So we were looking at what types of psychotherapy research are needed in India right now, either in terms of methodology or your themes or domains, etc.
See, actually, I would say for us in the Indian journals as of now, uh, if I lay down conditions, it's like, beggars can't be choosers. There's hardly any research that we get. Okay, at the level of psychiatrists, I'm saying. See, there are very important changes that I have seen. I was given a thesis on RTMS way back in 2006. And ultimately, when it was published after MD, it was 6th or the 7th published article on RTMS in OCD. So, but therapy is so old, and it has been a part of our curriculum. But when I see the surge in interest and publication in neuromodulation, so you can always see that the so-called novelty associated with neuromodulation, I don't see even 100th of that effort going into psychotherapy. My question is why? Now, there could be different possibilities. One possibility is that people are not adequately trained. I think that is one area. So if people are not adequately trained, they are not comfortable giving thesis, projects, and other things related to psychotherapy. So if the work is not being done, how can you think about publishing? This is number one. So number two, since there is not much, pharma or any kind of industry pumping money into this, so are we actually finding a dearth of research because of that? So when it comes to complete lack of focus in research in this area, asking for areas which could be better or which could be preferable is kind of luxury for us, for all of us who are in this panel, because there is hardly any research. So any kind of research which follows the basic methodologies is welcome. This is number one. Number two, are we also looking at a new era where probably this advent of AI-based therapies, a group of technology-related professionals showing interest, and probably there could be certain startups, people actually thinking of monetizing work related to AI-based therapies, that may induce some kind of research and publications in this area. Because if you have to develop an app, you have to somehow publish it, validate it, create a scientific evidence. So probably we will, in the next decade or so, even in India, with so many startups investing into it, there would be a flurry of submissions and research wherein we will have to determine the actual ethics part, how it has been done, whether it has been done properly. As Dr. Rajshekhar was saying, we should have proper mental health professionals as part of the team. So I think I'll be getting, will be getting a good number of submissions in this area. So core psychotherapy probably, will never regain the novelty that it had, or it deserved, or it needed. But probably we will get now a surge of research related to psychotherapy, but mostly AI based, app based, and technology based interface basically, because there will be money, there will be a pressure to publish, and there will be a pressure to kind of generate research and evidence in this area. This is how I foresee it. Now coming back to one solid part, I was having a discussion with Dr. Kishor also today afternoon. In fact, it was his honest suggestion that we should, no matter how much or how minuscule it is, encourage research on the biological, rather the neurobiological or the neuroscientific basis of psychotherapy, because there is still a general notion that it is like any kind of a gyan that you are giving, and the person is being influenced by your vocal tonic. So the idea of the fact that actually it causes neurobiological alterations in your brain circuits. Most of the initial studies published worldwide has been on animal models, but there are human models also. Institutes like NIMHANS, which have fMRI and other facilities and adequately trained experts, can take the lead. Even very small samples also, ruling out the confounders and all, if we get and can generate some evidence, I think that will be a great leap in the direction of promoting psychotherapy and making people believe that it is not just pep talk, it actually does work in the level of the brain. Thank you.
Thank you, sir. Thank you. Covered a lot of aspects, and I think you're also saying that if you're looking at scalability, feasibility studies with digital and technology integrated therapy, that would also be welcome, and that's where the future lies as well. And of course, your point on in terms of the mechanism and process-based psychotherapy research, because I think a lot of psychotherapy research, like some of the editors were saying, is focusing on does it work, but you're talking about why does it work, for whom does it work, and are we able to elicit a mechanism of action as well? Yeah. Thank you, sir. Thank you so much. I'll go to Harbishettar, sir. Sir, what are your thoughts, sir?
I think most of the things have been covered. I don't know what's left, but I'd like to drag your attention to one issue that one of my colleagues, I won't name now, people will know, when he made a video on side effects of psychotherapy. There was a hoo-ha, and that to the extent that non-clinical colleague, different departments had complained, so many places. I mean, come on, everything has side effects. I mean, you're not studied, you don't know if there are any side effects of psychotherapy. You have to really work. And in UK, when we are practicing, we had to give an information saying that doing any part of this therapy, that if you feel unwell, you're in crisis, this is the thing you have to do, and you can stop and all that. You have to tell. And even when you're doing therapy, research on therapy, I think this has to be added. A clause has to be added. Are there any, you have this regularly in the form that you need to fill in the ethics committee form, application, right? That are there any adverse effects? You can't say no point blankly. No, how can you say no? I mean, it's clearly well known that when you're trying to do a psychodynamic therapy or crisis management, you bring in some past issues, and you are bringing from a deeper level to a surface level, and you created some restlessness in that patient, which was buried under, and you're brought in. And who is responsible for that? You can't say, I'm not responsible, that's your problem. You have to know there are some adverse effects also. It's not completely like saying that this has no adverse effects. That's totally wrong. So to add to the list already, which was mentioned, adverse effects of psychotherapy, research is required. Different types of methods, like I mentioned, qualitative research, because you go in depth. Qualitative research is extremely important. We need some people to teach us to do qualitative study. Of course, I'm trying to include in my webinar series And also I want to include how to write a paper on psychotherapy research. Also, I can include, if Suhas can suggest me a speaker and a moderator, then definitely you're in. Back to you, Suhas. I think I've covered. So anything, even like a scholars corner or a PG corner, a simple, like you take up one issue. Like in my psychotherapy group, I have 5 people in my psychotherapy group, going on for last about 1.5 years now, and we are coming to the end. And there, I'm asking. I made sure that all did one CBT on in insomnia, and they prepared modules also. And I've asked them to write up, and of course, because they're still final year of MD and they're about to submit their thesis, it's very difficult for them to write, but they're ready with the to write their experiences. And I'll be glad to, in fact, beg and submit to my journal and try and include that. The reason for that is it's my vested interest as an editor, because if I publish a psychotherapy research and psychotherapy interesting article, it will get cited, and we are in for next level. Hopefully, fingers crossed, PubMed soon. I don't know how many years, but Rao sir is there guiding us, so I'm least bothered now because he's a guiding force. So it is my best interest that any article, any type of research, anything on psychotherapy, which is methodically done. And to be honest with you, for SRMA also, I have an article here which says Cochrane risk of bias tool for psychotherapy kind of research, where you can skip 1 or 2 elements of that scale for psychotherapy that we implemented in our SRMA, where one column was left unattended and said this is not applicable for psychotherapy kind of research. So that article also we have. So I think it's a motivation that starts from what the program you all have come together today. That'll be a good start, I think. Back to you, Suhas.
Thank you, sir. Sir, I'm going to not leave you there. I'm going to ask you 2 follow-up questions, 2 very precise questions, because you brought up 2 points. One, you also spoke about the adverse effects, and there was this huge surge of pharmacotherapy when pharmacotherapy research, psychopharmacotherapy was at its peak. One of the things that was, there's a lot of underreporting of negative findings in psychopharmacotherapy. Do you think the same problem exists even in psychotherapy studies, like studies that are showing no benefit or therapy didn't work? They are often going unpublished, but that's also important data. What's your thoughts on that, briefly?
Even attrition itself is an important thing.
Yeah.
We cannot ignore. Why is it? Why are we not able to hold on patients for long? Of all so many people, five of them have accepted to do therapy for, let's say, 25 of the 25 patients or 30 patients. Many they could not carry on for long, and they had to drop the idea of doing therapy because various reasons. Now we don't know the reasons for attrition. We don't know the reason why we are not able to engage. So I think the psychotherapy research has more potential, more chances of publication, and in fact, you have what is the word I'm looking for? This is a spark that created that we can recommend this to our students who are coming next time. It might be simple motivation interviewing in addictions that can be implemented in other. Same motivation interviewing can be adopted in other places for let's say borderline personality disorder and those kind of things. So I don't know whether I'm answering your question, but
yeah. So publish. You're saying publish. Even negative findings, attritions, logistical challenges. Publish. Psychotherapy. That's what you're clearly saying, right?
I'm one of the editors where I don't look at the final result.
Right.
That this has not given any significance, so I won't publish. No, I just want the methodology to be right. So even if it is, yeah. Sorry.
One very quick, but I'm just constraining this because of time. One more quick point from you. As an editor, if you're evaluating SRMAs in psychotherapy, what constitutes a strong SRMA? From, say, a superficial one, what is it that's an editor you're looking for in a strong SRMA about psychotherapy? For the audience, if they're writing in the future, for them to know.
Um, Again, SRMA will depend on the number of RCTs or what observation studies that have already been published. So we are relying on the level of the quality of those primary papers.
Right.
So to have a kind of boundary, it will be very difficult. Anything will do. If it's not been done, go into Prospero. You just register quickly, slowly start doing it. And finish it off, and definitely it'll get published. I think.
Yeah.
Good. Have a good methodology. Strong. Follow the guidelines is what I would say.
Thank you, sir. Thank you, sir. I'll just come to Priyash as well. Priyash, what are your thoughts? What are the kind of psychotherapy articles that you're looking for in newsletters? And I also want to get your thoughts on this, because see, Mind's newsletter is perhaps a very nice example of a early career faculty run, student run initiative, right? There are similar initiatives across the world. In fact, if you look at Psychiatry Times, for example, they also publish a lot of research in psychotherapy. Do you think there is scope for Mind's newsletter to publish some of these as well? Not in terms of articles, but like in terms of news, this particular study has been published, giving summary of psychotherapy studies, or what are the other ways in which Mind's newsletter could represent psychotherapy articles?
Yes, sir. Definitely. Thank you, sir, for the question. As all of my seniors have already pointed out, that there is a lot of dearth on research pertaining to psychotherapy in the Indian context, in the Indian setting. And what we look for as a research or maybe as articles in Minds newsletter is any basic article, any basic educational piece, or maybe an experiential account or reflective account that could do for the Minds newsletter. That basic purpose being to serve as awareness, or maybe to give ideas, a stimulation to the rest of the students who are reading the Minds newsletter. Just a couple of weeks, I was in the IToPS conference, the national conference, which was held in Bhopal, and there was this technique being discussed over there, BEAT technique. And I was surprised to, I looked it up on the internet, and I was surprised to know that there were not many studies. There was just this single article pertaining to the BEAT technique done in India. While there was this article in the Middle East where they applied BEAT technique to relieve preoperative anxiety in the patients, to use it to relieve the preoperative anxiety. So that is the kind of maybe educational pieces regarding these basic techniques, maybe frame model, maybe BEAT technique, which is what we are looking for. Or maybe students can summarize the articles that they might have read in the other newsletters or maybe other journals. We are looking for the summary pieces as well, so that we can provide them a stage to have that stimulation to work on bigger researches. So that is what we are looking for, sir.
Priyash, would you also be considering publishing, therapy pearls or some case learning notes from residents as well? Is that something you've thought of?
Yes, sir, definitely. That is something we have thought of, that maybe they can come up with their own case reports, therapy notes that they have used to provide the therapy to the patients. These are the kind of articles that we want to, maybe even first person articles, because the younger generation is quite aware of the psychotherapy, and they have their own first person accounts regarding the psychotherapy. So those kinds of first person accounts are also something that we are looking for.
Thank you, Priyash. I think we have just about time for one more round. Very quickly, we'll go about looking for some concise answers. I'm going to go to Rao sir and ask him, sir, you have been a UG teacher, a PG teacher, a super specialty teacher. What are your thoughts, and what would you expect specifically from UG students and PG students, especially, to enhance publication in psychotherapy? And because there are many residents here, some residents here, what would be your one message for them?
What Dr. Harbishettar mentioned is very important and pertinent here. See, there are journals which outright don't consider anything related to either qualitative, narrative, experiential, and things like that. There are some journals that don't even consider even review articles. You got the point. But there are other journals which actually encourage some of these topics. I'm very happy because this is a new branch, and many of the cases, what actually we get, there are initial experiments on a limited number of cases. In fact, they won't meet what we basically call a very rigorous long-term big studies and all of that, including RCTs, not possible to plan in certain areas. So it all depends on the editor, the theme or range which actually is willing to accept, and many of those type of aspects. That is one. From that particular angle, Journal of Psychosexual Health, we are encouraging many of the articles which are not likely to get published in other journals, not because of anything, but because they are either qualitative or psychotherapy based, or certain newer and other related ways. Actually, they are trying to look at the problem. See, even biologically speaking, let me tell you now, I still remember as a postgraduate student, there was a very great review by one of the editors of British Journal of Psychiatry, how psychoanalysis and biology can be actually brought together. See, what we are trying to look at is actually here, there are few things which actually look like purely at level conjecture that it is psychological, but there is a very significant domain under which it can be actually understood, analyzed, and all of that. So my aim is here to see that it is scientific, it is actually worthwhile looking into, and some of these areas needs encouragement. So I strongly agree that this is the way I try to look at it, and there's a big scope for in our journal for this type of things. You are muted.
And for students to publish in the journal as well, right, sir? Even for PG residents, yeah?
But we encourage, and but I'm very fortunate to have quite a few people who have improved some of the articles and submissions based on what is actually necessary to be done. We try to encourage people in that particular fashion.
Thank you, sir. I'm going to go to Sujit, sir, and quickly ask him the same thing, sir. If and perhaps in terms of, sir, you can focus on the faculty. What are the kinds of psychotherapy publications that psychiatry faculty can actually now focus on? Psychiatry teachers should be focusing on. What are your thoughts, sir?
See, here I would say that maybe the younger faculty would undergo training if they have not been exposed adequately, and can change their perspective over a period of time. But if you look at those at the level of associate or at the level of professor, maybe they would not be in a position to overhaul their training and understanding of psychotherapy. So people usually tend to give thesis on those topics on which they are comfortable. So this is one area. So first of all, there could be simple interventions based on psychoeducation or similar kind of modules. This is one possibility. Second is, rather than going to a same group of major psychosis or anxiety, you can actually think of doing it on patients with chronic distress, basically a consultation liaison kind of an approach. For example, those with chronic, say, for example, some chronic joint condition, fibromyalgia, and things like that. So that is one area where similar kind of interventions can be arranged, and that can actually do a lot. First of all, to improve or to generate interest, not only among our own faculty and students, but also on departments, other departments. So that will help. This is one area, considering our own training, and maybe those who have limitations in their training of therapy. This is one. Secondly, areas related to long-term things, for example, like relapse prevention, long-term intervention on persons with major psychosis, especially long-term follow-up, care, rehabilitation, and therapy related to basically reintegration of these people, to what extent it can be helpful. Obviously, there would be an overlap with occupational therapy also, but this is one area which can be thought of. Number three, in certain areas where you don't have adequate training, but you can always collaborate with your psychology colleagues and develop certain modules which may not always be manualized, but certain eclectic modules can be developed, which can be time limited, and can actually, if you can actually go ahead to validate them, they can actually prove to be cultural friendly models, as has been talked about by Dr. Rajshekhar and others, and that can go a long way in being adopted in our own culture. So rather than, as you were saying, being completely enslaved by the so-called Western manualized approaches. For example, if you think about intervention using, Marshall Linehan's DBT, that may be too time consuming, you may not be having adequately trained people, but maybe on a similar group of distressed individual, if you try something eclectic, something more Indian. In fact, I think many of us have read, about Dr. N.N. Wig's articles in IJP those days, the Hanuman complex and other stories. And then there is work going on in Nemans also, how to Indianize psychotherapy. So some of these models can actually be properly done if they can be put into rigorous modes of research. So the faculty should concentrate on this. Number one. Number two, if they find it difficult, they can talk to their fellows of the department. Now, IPS as a whole is a big family. IToPS is there, Kishor and all this whole team is there. So, supposing I am planning a research and I feel that certain areas I need help from anyone, in the country and beyond. So I can always, take them as co-guide and take it forward. So I think we also have to get out of our own limitations and get out of rather our comfort zones and think a little beyond. Another contribution I think which we all should make, I think this is my suggestion to Rao sir actually, what UGC has done, not UGC, sorry, NMC has done. UGC has a bank of thesis topics. It is known as Shodh Ganga. So what NMC did was, NMC actually built up its own repertoire on medical topics related to thesis, and it has been named as Medical Shodh Ganga. So if we go to the Medical Shodh Ganga site in NMC, then you will find around 100 odd topics of research or thesis which have been pulled by faculties from all over the country. So my suggestion is that one, with ICMR, you cannot suddenly add more topics in the medical Shodh Ganga, but IPS, Indian Psychiatric Society, IToPS, we can have our own bank of thesis topics. Maybe we can either put it up in the website or some other places where it is more easily accessible. Because if you remember, in a busy hospital, in a busy place, sometimes topics are decided very fast. Not adequate time is being given in deciding the core topic of the thesis. So if we can actually build up a bank of thesis topics, which should include well-chosen practical topics on psychotherapy, I think it will give more and more ideas to faculties across the country, and it will definitely lead to greater surge in research than we are seeing nowadays. So rather than telling people, we can actually have hands-on topics, properly formulated topics. Maybe some of the bigger institutes can take the lead, and all of us can do, and IPS can actually build a bank, and that will go a long way in promoting not only psychotherapy research but also on other areas of priority research which do not find proper focus when our faculties decide on the thesis topic. Thank you.
Thank you, sir. Very interesting points, including your first point on CLP-based psychotherapy, and now your last suggestion, which I think is a very, very good and an important suggestion, the thesis bank as well. I'll quickly move on to Rajshekhar, sir. And sir, what are your thoughts? What are your tips and suggestions for residents and for early career faculty to conduct and publish research in psychotherapy?
See, one big problem is there's a big disillusionment in psychiatrists that psychotherapies do not work. The reason for that is, unfortunately, they have been trained in institutes where there was no exposure to psychotherapy. So there's a very, very important need for the faculty to understand, that just because I'm not doing does not mean it does not work. So if I don't have the time, if I don't have the expertise, I should try to see at least that my residents are trained or should be appropriately sent to those institutes where they have the such training. That is first part. And it is also very important that faculty members should be involved in multi-center psychotherapy trials. Though it hasn't yet started, but somewhere down the line, I think they should do it. Coming to the postgraduates, it is very important, see, not from this therapy research perspective, but when I was doing my post-graduation at CMC, we were supposed to, at TSS Rao also is from CMC Vellore. We used to have, I think it is there at Nimhans also. All the postgraduates are supposed to have at least one psychotherapy. They should do one psychotherapy long and short during their PG curriculum. So similarly, for the thesis, for research also, it's very important that they should participate in designing and conducting a prospective psychotherapy study, a manual-based therapy, which is Indianized definitely, with proper implementation of scales. Again, it should be locally validated with appropriate statistics and all that. And undergraduates also have a role. I think it is very, very important that, see, we do get a lot of submissions from psychiatrists. Like just today, we got a submission where all of them were psychiatrists. So I don't know like what is their expertise. They said that they did some CBT. Not really mandatory, but at least we should try to see that there is a qualified clinical psychologist as part of the team. Let us give proper respect to them. We are a team, and we should definitely have in there as a partner, and definitely we should conduct well-designed clinical studies. So from the faculty perspective, there is very important need for a change of attitude. From the PG's perspective, they should be part of the designing and conduction. And also there's a problem. There's actually a conflict of interest for those faculty members who believe that therapists work. Actually, they report better outcomes when they do trials. So blinding also is very important. I think everything should be a part of the methodology when they're doing it. And definitely there's a very big scope for those who are in private practice. People claim that they see a lot of hundreds and thousands of patients in their private practice. But it is very important that they should do it in a proper way, take proper consent from them. Because many times we know that when we do private practice, we just report saying that, okay, we put in YouTube video saying that I did so-and-so therapy, patient improved. Was a proper consent taken? We don't know. Many times we have seen that they don't even mask the patient's face. So all that is the ethical part, all that is very important for the faculty to understand, and PGs also. Thank you.
Sir, thank you. Very good points. And one follow-up question, sir. You spotlighted a very important issue. Psychiatrists and psychologists and publishing from coming from only one discipline is a problem. Why are psychologists and psychiatrists not publishing together enough? What do you think are the reasons for that? And is there something that journals can actually do to support and strengthen such collaborations?
Unfortunately, Suhas, this is a problem which is probably unique to India. In this country, we believe that we are enemies, which is not the truth. We are the team. At least those people who are trained in institutes, we know that when we used to go for grand rounds, psychiatrists, clinical psychologists, occupational therapists, rehab people, nursing staff, everybody used to come and do the rounds together. And we never felt like we were enemies. But in those institutes which are not the so-called enmity has come, we do not support each other. So I think it is basically about the attitude. What I was trying to tell is team should consist of a psychiatrist, at least a psychotherapist, clinical psychologist, and at least the psychologist should have an adequate training, and it's more about learning from each other. Thank you.
Thank you, sir. Thank you. Harbishettar, sir, are you there?
Yep. Yeah,
So,
I think most of things again have been covered.
Also add on the fellowships and the super specialty parts also, because there also, in terms of publishing in psychotherapy, should increase. If you could just touch upon that as well, if possible. Thank you.
Yeah. Okay. So I'll have to share my experience in UK. I worked in Leeds where psychotherapy was mandatory, and we had a very good program. And in fact, at some point, they also started this higher training in psychotherapy. And the fact that they realized that what after their psychotherapy training, will they get enough? Are there enough jobs available as a psychotherapist? Then they realized that it is NHS. We don't know the funding crunch at some point. So they decided to merge with general psychiatry. So their training increased to 5 years with dual higher training in psychotherapy as well as in general psychiatry. I don't know how many of you know that people who are undergoing their psychotherapy higher training, it's a mandate that they have to undergo their own training. I'm saying not training, it's their own psychotherapy. And they have to look upon for a therapist, and they have to actually pay from the pocket, and they get the therapy done for about 6 months or 1 year. They have to show that they have done it. So that is the level of rigorous understanding the therapy that they have a module, they have diploma in psychotherapy and all that. So people who are my SRs also, they have one of the SRs, my SR actually joined in Leeds. She completed her diploma in psychotherapy and she liked doing it. So again, I'll have to ask Dr. Kishor and team to first come up with the curriculum on psychotherapy training itself, and then comes slowly the research, the higher training and research, and why not fellowship and DM in psychotherapy in future? Definitely, there's a scope. We are expanding. There are many psychiatrists coming out now. I think they may have time. Whether this will yield is something we don't know. That I think some psychotherapists are making good amount of money by doing psychotherapy also. They charge well, and they offer good psychotherapy. So there is some potential there also. It's not that saying that I have 500 patients in a OPD in one day and I make so much money. I'm talking about the private sector. So I think there's a lot of potential, I guess. So that also need to be explored. I think I have covered. I can't think of anything else.
Yeah, thank you, sir. I mean,
Yeah,
I think
Kishor mentioned one thing. I think this is something that Dr. Kishor mentioned here. Biological aspect. I think, yes, psychotherapy, fMRI studies. Yes, perfect. I think I'm not sure if what Demands has done, but I've seen this anyway. So this has been done before. There is an impact of psychotherapy on the biochemistry of the brain, the neurochemistry. So that's something people have to understand, that therapy also changes the brain, not structure, but the biochemistry of the brain. Yeah. Back to you, Suhas.
Thank you, sir. Thank you. And I think there are some organizations also that run the specific psychotherapy courses, no, like Park in Bangalore, and you have the PTRC in Bombay also that run the psychodynamic course and psychoanalytic course respectively as well. So there are organizations doing this, but it's an interesting thought to have a dedicated fellowship for it and, to integrate it within the curriculum. And of course, so those who are undergoing the course and the training, whether they need to undergo psychotherapy themselves is an interesting thought. I think a lot of food for thought there as well. Yeah, thank you, sir. I think Priyansh will come to you. And what are your thoughts? I mean, in terms of you've heard a lot of esteemed senior editors talk about in terms of how do we get people to publish in psychotherapy, and young faculty and researchers. What are your thoughts in terms of the newsletter? What do we do, especially because it's the level of clinical relevance there might be very high, and many people might not be, in terms of reading a journal versus picking up the Minds newsletter to read about a summary of a study. What do you think the odds are?
Sir, odds are quite not in our favor. But again, the way Minds newsletter is poised at, we think of it as a kind of a sandbox for the students to come over there, experiment with whatever ideas they have, maybe commit mistakes and learn from those mistakes so that they are prepared for the bigger journals in the long run. To get the newsletter to them, we need to ensure that, and to get the psychotherapy to them, we need to ensure that we start young. Like the psychotherapy training has to start from the undergraduate level itself, as was the consensus in the psychotherapy national conference also, that we need to start them young. We need to get them engaged into psychotherapy as early as possible, so that they have favorable opinions regarding psychotherapy, and also they have a lot of ideas, their own ideas, that how can they help this particular field. So that is one thing that can be done regarding allowing psychotherapy research to flourish, is that we need to pick them young and in the early part of their career itself.
Thank you, Brian. That's actually very wonderfully put, and a very important point. To start from the very beginning of the course itself and get their interest is a very, very valid point. Yeah, I think we're just about running out of time, and we have just a few questions that we can take, and some of the other senior faculty here also can give their thoughts. I'll start with the questions in the sort of chat box that is here. I don't know if Dr. Sapanjit Sahu is still here. So if you're here, you could just unmute and ask your question. Are you here, sir?
Yeah, I'm here.
Yeah, so you can go ahead.
Yeah, I was enjoying all the discussions going on, and it is very good to hear from the eminent editors about the various aspects of the research and publication related to psychotherapy field. I have mentioned the question in my chat post also. One of the concern, like everybody has spoken, is that we give thesis very rarely in the field of psychotherapy, because we have the resident only for 1.5 years who will do the thesis. In that short period, to do a module-oriented psychotherapy and the sample size, again, the validation issues are very much difficult to get it published. And as you know, to get any project with related to psychotherapy from the ICMR or DST, then there is another issue. And for psychotherapy related project, again, we need to have a trained psychologist. Many a time the resident or the psychologist who have to undergo the training itself to conduct the psychotherapy in the part of the project. Again, that is an issue. So what happens is that because of all this issue, the psychotherapy research is very difficult to conduct. And again, when we submit such articles based on if a project or any study, we get the comments from the reviewers many a times that the module, was it validated, was the construct validity, and all the validity was done or not, even though CTRA registration, which I concur that is important. But with regard to the validation also, there is a concern, and that gets rejected. And because of that also, that's again demotivate to do research with all these hard-earned efforts in the psychotherapy. And again, because there are various outcome measures from one study. So again, if we publish in 2 or 3 journals regarding the different outcome, that again the concern of the reviewer whether it is a salami slicing or not. So those are the constraints we face while we publish with regard to psychotherapy. And because of all this issue, I think the faculty at the institute, it's better to go for a prevalence study or cross-sectional study or any drug trial study, a head-to-head comparison, which gets easily published and the resident also find comfortable to do. So these are my concerns. If at all there can be some relaxation in doing the thesis related on psychotherapy, if at all a resident is doing or a psychologist is doing under any project, if some relaxation can be guided, then I'm sure that we will have more research output from India.
Thank you, sir. I'll just go for comments to Dr. Sujit. Sir, would you like to respond to sir's question and comment?
Yes, basically, problem with us editors is that we follow recommendations these days of certain bodies which are again having their own rules. For example, International Committee of Medical Journal Editors, or for that matter, COPE guidelines. And for every kind of publication, there are almost set rules and guidelines now. So we are not in a position to relax a particular method. For example, if you are planning an RCT, it has to be bound by the rules. Now, question is, where is the leeway? First of all, case series is one option to begin with. You can start with small case series, and wherein you have to publish the outcomes. This is one area where you can make a small beginning. This is number one. Number two, as Swapnajit was talking about validation studies and subsequently prior validation and then using it. See, the problem with NMC bound institutes like many of ours, we cannot always give a study or a thesis wherein you are talking about a particular validation model or on secondary data. But if you look at the INIs, whether it's PGI or the AIMS or NIMHANS for that matter, JIPMER, herein they are considered as like deemed universities, and here you can actually have even thesis topics entirely on validation. There is no one to stop you. For example, NIMHANS is nowadays having thesis topics on secondary data. But if I try to do the same thing in my institute at IOP, the thesis committee will not allow it to happen. So this is one way you can actually think of giving a separate validation study. This is if you are talking about time limit of a resident that way. Now, when you talk about salami slicing, the rules, as we all know, are very clearly laid out. So as long as the primary objectives are not identical in these studies, I mean, this is one of the gross rules. So you cannot be accused of a salami publication. So if the basic rules are taken care of, I think salami publication or salami slicing should not be considered as deterrent here. So a study can be planned accordingly. And as I was saying, countrywide thesis bank, a bank of psychotherapy related thesis, well thought of in terms of feasibility as well as methodological rigor could be one of the solutions. And as I was saying, that validation and other things, INIs are not bound to give thesis on particular or not to give thesis on particular areas. So herein, I think INIs can actually take the lead.
Thank you, sir. For the time, I'm just going to go to the next question. Dr. Kumaram also asks if there are any index psychology journals from India, and if so, what kind of psychotherapy articles do they publish? Anyone from the panel?
Yes, Indian Journal of Psychological Medicine. Over to the editor.
Yeah.
Also psychology, na? See, the name actually doesn't restrict it to psychiatry. So.
Yeah. No, that's an advantage as well as disadvantage for our journal, because TSS Rao knows that why it was named so. But see, we do get, and why
Could
we
you just
want
tell
to,
about it? Because I would also want to know. Seriously, I feel it increases the scope.
it increases the scope. In fact, I think Clarivate actually recognized our journal first as a psychology one. Later, around 1 year back, it got recognized as a psychiatry journal. So that's an advantage, and fine. We get a lot of citations and a lot of authors. That's not an issue. The issue here is, I think Indian Journal of Clinical Psychology is one journal, but we have our own journals. Like, for example, I think Indian Journal of Psychological Medicine is a good place to publish articles related to psychotherapy. We do get a lot of articles. I just talked about practical psychotherapy, but we get articles related to case series, type of articles, case series, sometimes as case report, occasionally as viewpoints. We do get a lot of submissions. Yeah. Sorry, Suhas, I'll just, I will go beyond what is asked of me. Dr. Swapnajit Sahu has asked about some concerns he has. I'll just talk about 3 things here. I think for postgraduate thesis, it is not difficult to do studies related to therapies. We have psychology colleagues. We can take them as our team members. We can very well do it. We are getting a lot of submissions from good institutes across the country where clinical psychology residents are actually, PhD residents are submitting. That is one part. Second is, 3 years is a big time. It's not a small time. Unfortunately, as faculty, we are not serious about it. And because of that, our students are not serious about it. Very early in the course of first year, if we start, By the end of 2.5 years, we can very well do complete a study. Second part. Third, about salami publications. See, I won't tell you the names. There are few high quality researchers in India. They have submitted articles which I very well knew that these are actually they were published somewhere. When I had requested them to mention that as a footnote, they don't want to do. See, there's nothing wrong. Let me not use the word salami publication. There's nothing wrong in splitting a study into more than one part. There are only two conditions there. First is you have to declare to the editor that the previous paper was actually published. Second is why it needs separate publication. Third, it should be declared. Referencing it in the references section is not enough. You have to actually declare it below the article that there is another article. It is accepted as per the international guidelines. You can have more than articles, but like what Sujit Sarkhel said, the primary outcome thing, what he has mentioned about. So there should be a very clear rationale as to why we are submitting a paper additionally. There's nothing wrong about it. The only issue is about declaration. Many of us actually in India, unfortunately, we don't want to declare. That is the problem. Thank you.
Rao sir, you wanted to add a point? Yes, sir. Please go ahead.
See, let me tell you. See, we did one study on Suttur population, and this was part of the ICMR study. And one study was related to all psychiatric problems. Then we separated out the data related to sexuality, and in fact, we won one of the award for sexual problems in the 60+ population. And one of the things observation was, see, somewhere around beyond 67, nobody was sexually active. See, this is the population. If at all you want to do a study, it has to be a narrative or some such study only it has to be. See, when we give some scales or whatever it is, it picks up only certain types of aspects. To go into the nuances that are involved, we have to go into deeper. This is one of the reasons why I believe that in our journal, I'm almost always very strongly an advocate of publishing certain things, because these are the people left out in the study, or they are part of some of the major data which actually doesn't convey anything in particular. So why 67 and beyond, why they are actually not sexually active, it needs a different type of approach altogether. Unfortunately, problem is no PG will take up this particular study. And when you are asking any of the other faculty to do this type of study, they will not agree for this. And these are the type of difficulties what we actually basically have. It looks like, say, for example, the same data has been utilized, but for a totally different purpose. And of course, as Dr. Rajshekhar Bipeta is mentioning, one can be very honest and clear about what actually has been done. That is actually important.
Yeah. Thank you, sir. There are a lot of state awards for psychotherapy, especially for PGs as well. I was just wondering from the panel here, do they get published in the state journals or the national journals? For example, IPS Karnataka has the Vijaykumar Award for psychotherapy. Vijay sir, do you want to add on this?
No, I think it's based on the write-up, what they have submitted to the awards committee.
Correct.
And I think
does that translate to a publication, sir? Some in the Karnataka journal?
We haven't communicated, or we haven't said anything such a thing, but I don't know how that can be converted to a paper.
Because
it's a good idea. It's a good idea.
Of Social Psychiatry, they run the Balance, which is the Balance Psychotherapy paper, and then they publish it in the National Journal, Social Psychiatry. Is that also possible? I was just wondering with the Karnataka journal, if possible.
I think it's a good idea, but it's getting wasted. But I think like an extended case report or something, or a grand rounds kind of a thing that can be done, I guess. And in fact, to give you an idea, whatever has happened today also, it's a very good write-up that you can submit, and I'll be happy to, send it to reviewers immediately if we can. Yeah, back to you.
Thank you, sir. We'll hold you to that as well. Yeah. I just wanted to give a minute. If Dr. Mohan Isaac is there, I don't know if sir is online. I saw him online earlier. If sir can just, any thoughts, sir? Any inputs to the audience and to the panelists?
Thank you very much. I don't know if you can hear me.
Yes,
Thank
sir.
you, Suhas. Yeah. It has been an excellent panel discussion. Compliments to all the editors. We have had a wonderful discussion on various aspects of psychotherapy. Of course, all the editors from various journals, which are being published in the field of psychiatry in India are here. Of course, compliments to the moderator for the comprehensive way in which the panel discussion was conducted. I just want to make one or two points. Of course, I did have the privilege of attending the conference in Bhopal, which was exclusively dedicated to psychotherapy, promoting psychotherapy in India. It's with the realization that psychotherapy has been going down in practical practice of psychiatry in India, in training programs all over the country, including in advanced centers. The emphasis given for psychotherapy, even as a as an ability that a psychiatrist, a budding psychiatrist has to develop, has come down, etc. So there was 1.5 days of good discussion, and out of that, the IPS, PG, and the UG committee chairpersons were there. The consensus statements have come out. I think it has been circulated in the EIPS. I think everybody should go go into that and then try and implement. Now, the other point that I want to mention is highlight on one or two points which came up during the discussion, and that is the lack of collaboration, lack of cooperation between other people in the country who do psychotherapy. I'm now referring to psychologists. Is it that we believe that psychotherapy done by trained, adequately, appropriately trained clinical psychologists or psychologists, but not trained psychiatrists, is of a poorer quality? I mean, many people mentioned, many editors mentioned in their comments that this is the problem. It is not just in our country, it's all over the world. For example, there is going to be the 6th International Conference on Counseling and Psychotherapy. It is the 6th ICCP. I mean, for those of you who want to know details about it, you can Google 6th ICCP, which is taking place in Bengaluru on 7th, 8th, 9th of January 2006. Now, this is the 6th in a series of International Conference on Psychotherapy and Counseling and Psychotherapy. Every 3 years it is held. It is a joint program between half a dozen other universities like the University of Toronto, Washington State University, etc., etc. I'm talking about this because I have had the privilege of attending all these, including I'll be attending the 6th one because I am an invited speaker in that. One of the reasons why I know about it is one of the chief organizers of this has been an alumnus of NIMANS. I'm referring to Tony Sam George, not a psychiatry department alumnus, but another mental health department alumnus. Why I'm saying this is, while a large number of people attend and they are very successful conference, there are not many psychiatrists who attend this. So this is a problem which is being noticed, and this is not just unique to India; it's all over the country. I think this is a schism which we should work towards and try and settle. Instantly, the theme of this conference is building bridges, partnerships, collaborations, networkings, etc. Building bridges for wellness in the digital era. And the second point I want to highlight is what Dr. Aleem Siddiqui was referring to. In fact, already, I think the last week or the week before that, there was a 2-page article in the Time magazine. I don't know whether it's the Time or the Economist. Will psychotherapy be taken over by AI, chat box, and already there are lots of apps which you can. It's not, of course, like a academic journal article, but almost to that extent. This is the real danger which Aleem was talking about, that if we don't move with the times, advancing and contribute add quality and value to this ongoing process, it will be taken away by us. Already psychiatrists are not talking enough with their patients, are not willing to listen to the patients, because we are losing that skill, because we are not being trained, we are not being talked about. A generation of teachers are not convinced about the role of psychotherapy. And it is from that perspective that I would also compliment the IToP for taking up the training program, the scholarship program, etc. And also my former colleagues in Nimans, the Raghuram and Matthew and all, for actively supporting. Thank you very much, Suhas, for giving me this opportunity. I must compliment you once again for moderating this whole thing exceedingly well, and all the editors for saying the right things. If a lot of postgraduates and early career psychiatrists have listened to this, I mean, they now know how to prepare manuscripts and submit to various journals. If, of course, a lot of them, because of the timings, weekday, etc., have not been listened to, I know that this is being recorded, and the recordings of this should be made widely publicized and made widely available. And now the editor of the Karnataka Journal has already said that if somebody takes the trouble of writing the proceedings of this thing, he will be already happy to consider, and he'll be sending it to. He didn't, of course, say that he's going to publish it because he has to get the reviewers, but he did say that if somebody is willing to write it, he will be happy to send it to reviewers. That's all. Thank you very much.
Yeah. Thank you. Thank you, sir. You summed it up so very well. And thanks for signposting us to that conference happening in Bangalore as well. I put the link into the chat, so if the audience wants to look at it, it's available. Yeah. I'm going to have to conclude this session, and I will just try and summarize some of, I mean, there were many points and significant.
Before you conclude,
yes, sir.
I'm very happy that I was directly the teacher of at least 3 people in this group, and examiner for at least 2, and very closely associated with all the editors. I'm really blessed and lucky. Thank you.
Yeah. Thank you, sir. Thank you very much. And I think you set the
Snatched all
path
the
for-
compliments. He snatched all the compliments now.
He snatched all the compliments, but he often does that, and he set the path for. I think Dr. Rao sir inspired a lot of people to become editors as well. I think that is a very important point as well. But yeah, I would like to thank all of you, and I think so many important points discussed. I mean, submissions from India do exist on psychotherapy. Volume, methodological robustness definitely must increase, as all of you clearly pointed out. We need well-designed quality work, qualitative studies also, implementation science, Indian adaptations, cultural adaptations, outcome-based work. SRMAs on psychotherapy is definitely an option. Across the training tiers for UGs also to work, start from the very beginning, like Priyash correctly said, in terms of reflection, awareness building based writing, going into PGs in terms of structured research with supervision. The idea of the psychotherapy thesis bank, I think, is excellent and should be taken up by the IPS at least, and IToPs. I mean, it's an outstanding idea. I think in terms of mentorship and the training pipeline, there was also discussion about how private psychiatrists should also publish the kind of psychotherapy that they do. The flexibility of publishing negative findings, adverse effects of psychotherapy, if any, and looking at AI and digitally blended therapy, etc., was also discussed. And of course, in terms of not just in terms of the journals, but using newsletters as bridges for wider dissemination, like Priyash wonderfully put it. So a lot of ideas discussed, more ideas generated, and this dialogue could easily have continued for another hour as well. But I'm going to have to end this session and thank, on behalf of the IToP, Psychiatry for You, Minds United for Health Sciences, and the IPS PG and UG committee. Thanks to all the attendees. And I think that we hope some of the discussions here empowers clinicians and trainees to write, research, and publish in psychotherapy. And of course, a big thank you to all the distinguished editors for their wonderful, for their time especially, and their valuable insights. Yeah. So very warm regards, and have a wonderful evening.
Thank you.
Thank you.
Bye.
Thank you so much, sir.
Thank you, everybody. Thank you, Dr.
Thank
Kishor.
you.
All the respected
Thank you.
seniors.
Thank you. Thank you. Suhas, you have to save it or stop
Thank
that.
Yeah, when I end meeting, it will stop, no, sir?
I think so. Yeah. You have to stop
Okay.
recording.
Recorded and then save.
Okay, sir. Show one, two. I am hitting pause.